Topic number 2. What mistakes to avoid while prescribing occlusal splints?
Most of the time when I see patient coming to my practice with already prescribed splint are that 99% of the time splints that were prescribed are failing to treat the problem. And what caused that? Caused poor documentation, poor X-ray analysis, poor treatment planning, and in this way most of the time patients complain with increasing problem, increasing pain and decreasing the range of opening. So in this way I would say to my colleagues a few things. If you're not trained to treat occlusal problems, please refer your patient to a specialist, because this can create a lot of problems to your practice and this can create lowering your reputation. Why? Because occlusal splints are more than just a barrier between the teeth, and most of the time splints and so-called bruxing splints are understood as we have surface between the teeth, and this surface will protect the teeth of grinding. But something more deeply that you need to understand is when you put something between the teeth, it's actually creating a new vertical dimension. And if this splint or if this structure is soft, it's not going to be only one position, it will be multiple hundred positions that the patient can have according to the force that he's applying on the splint. So having a good, precise, individual splint for patient requires many exams like X-ray of the joint, MRI, condylography, precise models, precise communication with the lab, because in the end of the day we need to give a good, precise solution for patient. And keep in mind that patient and human in general has TM joints which are two connected with one bone. So what does that mean? That left joint can be with bigger problems than the right, and in this way you need to treat the patient separate, left and right. And using this example actually have to give you an understanding that if the patient has no problem in the left joint, if you treat the right wrongly, you will create a problem in the left joint. So be careful how and what you're prescribing the patient to treat their functional problems, and if you don't know how and what, please send it to the specialist.